When a woman is diagnosed with cancer, her first thought is of her survival. When it's a young woman and she's facing cervical cancer, she may then have a second thought. She may never be able to have children. This is the story of two women who were faced with those thoughts. Luckily, they met a special doctor who performed a very specialized surgery, and today, they're not only cancer-free, they're moms too. Tonya Caldwell was just 25 years old when she received a diagnosis of stage 1B cervical cancer. Most women with that diagnosis are treated with hysterectomy.
It was hard hearing you have cancer, but it was even more hard hearing you may never have children.
Crystal Lasonde hadn't thought much about motherhood prior to her diagnosis of cervical cancer in 2011. Only 31 at the time, she was focused on her marriage and career.
It was just scared. I didn't know really okay, you have cervical cancer, but what does that mean? What does it mean to me? What happens next? All of those things. Of course, you think about what's going to happen with, how's my husband going to deal with it? How's work going to deal with it? You have all these thoughts that go through your mind because at the time, those are your priorities.
Fortunately, Tonya and Crystal were referred to Dr. John Boggess at UNC Lineberger Comprehensive Cancer Center. Dr. Boggess is one of a small number of doctors in the U.S. offering a procedure to young cervical cancer patients known as a trachelectomy.
The procedure was developed to remove the same amount of tissue but preserve the fallopian tubes, ovaries, and this part of the cervix along with the uterus and reconstruct it to the vagina without compromising cancer care. That was really a technique taught in France. It was very specialized. Very few people did it. But since we've been so involved with minimally invasive surgery and specifically robotics, we've been able to develop a procedure very similar, in fact, in my opinion, probably superior, which allows us to treat a cervical cancer with the same radical surgery, but preserve the uterus in the proximal part of the cervix. And we've been able to reconstruct the tissues in a way that a young woman could preserve the choice of having a child. And we've only been doing this procedure for about 5 or 6 years. It's not a common procedure. We do about 6 of them a year. I do all of them here, but we have 5 term babies so far, and we haven't had any negative outcomes with respect to the ability to carry a child.
So I went into surgery still not knowing if I was going to have children or not. It was, we're going to plan to remove your cervix and lymph nodes. However, if the cancer is larger than we thought, we will have to do a full hysterectomy. So the first words out of my mouth when I woke up were, can I have kids? Because I didn't know.
And what did they tell you?
Yes.
Now, 6 years after her diagnosis, Tonya and her husband are parents of 1-year-old Eli. Crystal was also happy to have the option to spare her fertility, but says she didn't fully appreciate it until she and her husband welcomed their son Jacob in 2013.
I love it. I didn't think I would love it this much. Everybody tells you how great it is. You're like, oh, whatever, because you're not in that kind of kid mindset, and you're never going to experience love like this. And again, you're just like, okay, whatever, and then it happens, and it totally is the coolest thing ever.
Dr. Boggess was among the first to hear the news of Tonya and Crystal's pregnancies and continued to watch the new moms closely. Both women say that he was just as excited as they were.
He's an amazing man. Every time I see him, he gives me a great old big hug, a high five, and he makes me feel comfortable and welcome, and I'm just very gracious for him. He's a very good man. I am overjoyed. I always wanted to be a mom, so the fact that I am a mom now is just, I wouldn't do anything else. I wouldn't change anything about it.